Hello, I'm Stephanie Domet. I'm the managing editor at Mindful and mindful.org, and I'm delighted to be hosting this conversation with Paula Gardiner and Stephanie Sarkis as part of the Healing Healthcare Summit. In this session, we'll talk about new frontiers of accessibility in healthcare through a lens of equity. I want to remind you that you can purchase lifetime access to all of our Healing Healthcare Summit content in a downloadable format. You can do that at mindful.org/healthcare. Now, the COVID-19 pandemic has revealed much, from just how interconnected we are to how much work there is to do on all our systems to make them more inclusive, accessible, and equitable. And my guests for this session both have experience with accessibility in healthcare. Dr. Stephanie Sarkis is a psychotherapist who specializes in ADHD, anxiety, and narcissistic abuse. She's a best-selling author and an American Mental Health Counselors Association diplomat and clinical mental health specialist in child and adolescent counseling, one of only 20 in the United States. She's a Florida Supreme Court certified family and circuit civil mediator. She's also a licensed mental health counselor and a national certified counselor, and she maintains a private practice in Tampa, Florida, where she specializes in ADHD, anxiety disorders, and gaslighting. She also provides telehealth sessions and facilitates collaborative divorce. And Dr. Paula Gardiner is the Director of Primary Care Implementation Research at the Center for Mindfulness and Compassion at Cambridge Health Alliance. She's an associate professor of family medicine and community health at University of Massachusetts Medical School. She directs the group medical visit program in the Center for Integrated Primary Care. In addition to completing her MPH from the Harvard School of Public Health, she also completed a 3-year clinical research fellowship in complementary and alternative medicine research and faculty development at Harvard Medical School. She's published more than 90 peer-reviewed papers on chronic pain, health disparities, technology, dietary supplements, stress, and integrative medicine in underserved patients. She also studied with Tara Brach and Jack Kornfield to become a certified meditation teacher, trained in mindful self-compassion with Chris Germer, and is a certified facilitator for Ron Epstein, MD, and Mick Krasner, MD's mindfulness practice program. Now, before we begin our conversation today, Paula has offered to lead us in a compassion practice. Paula.
Thank you so much, Stephanie. In this practice, what I'd like you to do, if you're willing, is to actually get really comfortable in your chair or your space and just take a look around and get a sense of shapes and colors. And when you're ready, if you'd like, you can go ahead and close your eyes, taking in a few cleansing breaths. Let's all do it together if you wish. Breathing in and out, and breathing in and out. And last time, breathing in and out. And now bringing an awareness to the body if you can. Starting to tune in with what are the different sensations in the body for you in this moment. Perhaps bringing an awareness to your face, the forehead, the muscles around the eyes, the jaw. And if you can, see if you can soften those. And now moving into the neck, the shoulders, the chest, noticing the sensation. And if you can, adding some softness, some tenderness, letting that area just relax if you can. Finding our center, welcoming ourselves at the door. These are all ways that we care for ourselves deeply. And many of us as clinicians are on the front lines serving patients in our communities. But we too need care, and we too need to offer ourselves compassion because we're all doing the best we can. And I wanted to share a practice today from one of my mentors, Chris Germer, called the self-compassion break. This has been so helpful to me in my own patient interactions. I'm hoping it will be helpful to you. In this moment, see if you can think about an actual situation or patient interaction that may have caused you some stress. Using your imagination, allow yourself to see that person in front of you, remembering what's being said, what the situation is, what the challenge emerging in. Even noticing as you imagining that you might have some discomfort in your body. And recognizing and saying to yourself, this is a moment of challenge. Wow, ouch, this is stressful. But bringing in our common humanity, offering yourself that challenge is a part of life. And I am not alone. There are other clinicians who are also having challenges like I am. Just like me, there are others who know my struggle. And the invitation is to put your hands over your heart, feeling the warm sensations of the hand resting on the heart. And with that beautiful, gentle touch, adopting, creating supportive touch for yourself, offering words like, may I be kind to myself. May I give myself what I need. I've got this. I can do this. I've done this before. And acknowledging and celebrating my compassionate self and health can help me. So see if there are any particular words of kindness and support that are coming that you need to hear right now to get you through this situation. Maybe, may I be strong. May I feel protected and cared for. May I be patient with myself and others. Together, we can do this. And if these words aren't landing for you, that's okay. Just take a moment now and think about what is the message that you need to hear? are the words that if you can't access for yourself in this moment, perhaps words of kindness that you would offer a dear friend or a family member, and offer them those words if they're struggling. And now see if you can add that same message now directed towards yourself. And as we transition out of this practice, the invitation I wanted to offer is for you to rub your hands together, creating some nice, beautiful warmth. And if you're feeling comfortable, see if you can just cup your eyes and allow that beautiful warmth to, to soothe the eyes and the cheeks. And when that feels like enough, with the tips of your fingers, see if you can just provide a little massage for the forehead, the tips of the fingers, even radiating down around the eyes. Into the cheeks. Beautiful touch. Now down into the jaw, opening and closing the jaw, even the tongue, moving the tongue. Wonderful. And if it's helpful, also bringing the hands on the neck. Oh, nice soothing touch to the neck. Opening the eyes. Nice stretch. Whatever, moving whatever way you feel like you need to move. Okay, wonderful. Thank you so much. Thanks, Stephanie, for letting me do that. I really appreciate that.
Thank you so much, Paula. I feel like we could spend the rest of our time together doing that, and it would be a service to all of us. But I so appreciate being able to have a few minutes of practice with you both and with our audience at the beginning of this conversation. And now I'm really pleased to welcome Stephanie Sarkis and Paula Gardiner to take part in this conversation. Thanks to both of you for spending time with us in this pursuit today. So let's start by kind of setting the table. Paula, I'll ask you to start and just briefly, what are some of the challenges that people who need access to care are facing, both pre-COVID and in our current context? And I'll just say, to really kind of set our context, because we're in a situation where things are changing really quickly in every sector, and especially in healthcare. We're recording this on January 21st, midday. People will be watching it in mid-February, and who knows what the situation will be then. But as it stands now, Paula, what can you say about the challenges that people are facing?
Well, I think if you're a low income person here in the United States, or even a person of color, probably worldwide right now, right? Like let us honor our international community. What we have seen from a medical perspective is that the healthcare disparities have really been uncovered in the COVID pandemic. People getting access to quality care, people getting access to housing, food, and that these patients that we care so deeply about have been on the front line, as service workers or, community workers. So right now, for people who are living in poverty in the United States and worldwide, I think, the struggles are real. And with the pandemic, also things like social isolation and chronic disease have also really been aggravated.
Stephanie, when the pandemic started, you moved your entire practice online. How did that change how your patients are able to access the care that they need?
I find that it's easier for people to access care. There are no issues with transportation. If people have an internet connection that maybe isn't the best, they can talk to me over the phone. I find that's really opened up therapy to a wider range of people that otherwise it would have been prohibitive as far as time from work. People can talk to me from the parking lot of their workplace. So I have people that talk to me from a closet in their house just to get some quiet, throughout the day. So there are different ways that telehealth has reached out to people that otherwise may not have had access. So that's been the silver lining, I think, of all of this.
Paula, the factors that you mentioned and you touched on this, can easily be complicated by issues around race, class, culture, discrimination. How are practitioners engaging first with those intersections, and then secondly, with mindfulness to help ease some of those friction points?
Well, mindfulness is just an amazing tool to help us embody and really recognize all of the different types of sensations that are occurring. And when for myself as a clinician, I've been using the mindfulness tool in my day-to-day interactions with patients. And when I am trying to be aware of my own white privilege, if I'm not able to provide for my patient the kind of care that I would like amazing housing, food, affordable medications, when I'm in a situation at work where I cannot offer those things and I'm feeling moral injury, I'm using my mindfulness to notice those different sensations in my body and really sit with that discomfort, not try to push it away, but to really be present. And then if I'm unconsciously saying something or doing something, using that mindfulness to help me have a richer, deeper conversation with patients.
Can you say a little bit more about the kinds of situations that you might be in where you're unconsciously, saying or doing something that is not helping that patient receive the kind of care they need?
Oh yeah, absolutely. I think like a great example is, I've been working in the COVID tents, and last year I was in the COVID tent. When patients came in with cough or fever, we were testing them, and this was in the early in the pandemic. And I had a really wonderful man come in who was Spanish speaking and new to this country. And, he got tested, and what he needed to do in that moment, Stephanie, was follow up with his primary care provider. But what he said to me was, Paula, Dr. Gardiner, I do not have a primary care provider, right? I'm here illegally. I don't have the documentation, and I'm scared to go to a primary care provider. And this to me was heartbreaking because everybody should have access to medical care. And so in that moment, it was really like just being with this this tension around him needing to protect himself and being concerned for his family, but yet he still needed to get tested for COVID and needed follow-up for COVID. So being in that complexity and really feeling that heartbreak and trying to figure out how do I help him get the care he needs, and just embodying that.
How does feeling the heartbreak help?
I think that it helps me not live in denial, and it helps me try to really be compassionate with my patients and see them as human beings who are suffering. I'm a human being. I'm not perfect. I'm suffering. They're a human being. They feel the same thing I feel. So it really helps me stay compassionate and in my body and connected to my work, connected to my humanity, and not, you know, not be angry or deny or push people away who need my help.
And if you weren't doing that, feeling the heartbreak, staying, out of denial, how might that interaction with that gentleman have gone differently?
Oh, I mean, I think I could have been unprofessional, meaning I could have been rude or I don't care or you're on your own. And that's not what clinicians are about. Clinicians are teachers, they're healers, um, they're helpers, right? We're trying to help our fellow person. So the skills of mindfulness and compassion and having both of those wings, really noticing, being in the moment, present moment, with all of my emotions and all my happiness and sadness, but then at the other wing of compassion, and having both wings there, compassion for myself, noticing that this is a challenging time and I'm suffering like everybody else, and that having compassion for others, even my wish to help them, even when I'm not able to help them the way I want. Holding both of those together has really been so helpful to me.
Stephanie, for you, being able to see where your patients are in a new sort of literal way, where you can see where they're living and how they're living, how has that, changed or deepened the kind of care that you're able to offer?
I think that's opened up the therapeutic experience where I can see where someone is talking to me from, or I can see the environment, because a lot of what we go through as humans is expressed in how we take care of our surroundings and what access we have to take care of our surroundings. So I think it's been very helpful for me to see. And also sometimes clients will even say, hey, let me give you a tour of where I live so you can know a little bit more about me. And I think it's a really good gauge of where people are in mental health. And I think that's opened up a whole new avenue that I would not have seen in person.
What are the complications for somebody who maybe isn't living in a safe environment or is in an abusive situation? How can telehealth, reach and speak to that person?
I think people are more able to communicate over telehealth rather than coming in person, especially if someone is being very, if a perpetrator is being very, I guess, stalkerish, for lack of a better word, trying to follow someone, that someone can talk to me during their lunch break at work from the parking lot in their car. So they aren't followed, they're at work still. So I think that there's aspect to that there's more of a safety in being able to speak to me rather than having to say why you're going out somewhere in cases where there's domestic violence. So I think that's a benefit. I think also for parents that have minimum amounts of time to talk with someone alone, I think it does offer them the opportunity to do that instead of getting in the car, figuring out childcare, getting in the car, driving through traffic, getting to the location, and you have to, where I live, you have to judge, how many, in a lot of cities, how much time is it going to take you to get somewhere, right? So you have to tack on time to that. So I think that talking to someone just from the house and having a friend or relative come over, if possible, to watch the kids while you talk to me, I think has been really helpful and opened up therapy to a wider number of people.
And then what other tools are you using? What other kind of wired or internet tools are you using, Stephanie, to reach and provide care to people who, you know, might not feel that therapy is a fit for them, or who may have other reasons that they can't access therapy?
So what I do in order to reach out to more people, especially people that are victims or survivors of narcissistic abuse, is I have a podcast. I also post on YouTube. I post videos. I make sure that my Psychology Day articles are also in audio format for people that need accommodations. So I reach out in a variety of different ways. So the social media channels are very helpful because those are free access for people. Podcast apps are free access, many of them. So I think that that's a great way to reach out to people, the people that, you know, otherwise don't have access to mental health treatment. It's cost prohibitive. They don't qualify for pro bono services. So it's a way to bring everybody kind of together. And there's a universality, especially when people are commenting on a YouTube video and they're sharing shared experiences. There's that concept of universality that you realize you're not the only one that's going through this. So I think that's very helpful. So those are just some of the ways I do it, is through podcasts, social media, through the books, obviously, and then also just through just doing interviews and videos and posting those on my site. And again, that's easy access for a lot of people just to watch that, especially when they only have a few minutes in between tasks in life to glean some information that can improve their lives.
Even just to get the idea that they're not alone, or, you know, I know gaslighting is something that you deal with too. So the idea that they're not, you know, that what they're experiencing is connected to reality, and it
Right.
gives them a little thread to start to pull.
Right. And I interview people from all different types of specialties in all different areas. So they may listen to my podcast and learn about parallel co-parenting if they've got a high conflict co-parent. They may listen to Dr. Mark Burton and learn more about mindfulness and its applicability in parenting and also just in day-to-day life. So there's a wide variety of ways that people can reach out to people in the community through the use of social media and through the use of podcasting.
Paula, did you want to add something? Yeah, go ahead, Paula.
One thing I wanted to say is, I think people there's a big opportunity right now around insurance coverage of telehealth and, you know, video or phone. And with the pandemic, we have seen our country mobilize and really get behind the payment of telehealth. But when the pandemic is over, it will be up to discussion again about whether these things continue to get insurance coverage. So luckily, Stephanie, behavioral health seems like that it's going to be moving forward with coverage, but not necessarily medical care or primary care. So I just really want to make sure that people are aware around the coverage issues of health. And then also just recognizing that in the United States, the pandemic has really pushed forward this idea of the digital divide, meaning that in our society, there are people who can afford social media and telephones and, you know, iPhones and iPads and computers and have internet, and there are those that don't. And that could be even the access of internet in a rural community. So I'm really hoping that over the next few years, that digital divide will even out and everybody can get access to really good communication using the internet.
Yeah, that remains a gap where there are so many opportunities for these digital communications to address some of the access issues in healthcare. Of course, there's another population that still doesn't have access. Paula, when Stephanie was talking about the kind of mentoring that might happen in the comments on a YouTube video, it made me think of something that you told me recently about, and I think you called this integrated body and mind healthcare, where you might have a group of patients who you're seeing.
Yes.
Yeah, can you talk a little bit about
that? Oh yeah, of course. So, you know, in the United States, most of our medical care is provided one-on-one in a clinician. But actually, since the 70s, there's another model of care called a medical group visit. And if you think about it, you know, we as humans thrive with social connection. Our brains are wired to be happy when we're with other people. And I think that the social isolation of the pandemic has really shown people how we need each other. So what we actually do is we provide medical care in a group of patients with a clinician who's usually a biller and a clinician who's usually not billing. But this group, which we are now doing online, is just a way of providing medical care and teaching skills that you may not normally get to learn in medical settings like self-massage, acupressure, mindfulness. And in a way, a lot of our mindfulness trainings like mindfulness-based stress reduction, mindfulness-based cognitive therapy, these are all done in groups, right? And is there something about being in a group of people that catalyzes our ability to learn these types of techniques? And so what we're doing is teaching people mindfulness and meditation skills in an online medical group visit. And that it's a win-win because the clinician can bill, so we can cover the cost of offering the group in a medical setting, and the patients are getting those basic mindfulness skills that they can really benefit from.
But that the clinician might not be able to bill for, or that the patients might not be able to access because of the cost of them. I think this is so creative and innovative. I just love it. It's like this simple but elegant solution.
Well, we know that in the United States, when we've looked at where is mindfulness being taught, where are the acupuncture studios, where are the yoga studios, from the work of Rob Saper, who did geomapping, we know that those modalities are more likely in the higher income neighborhoods. So, you know, it's funny, like we have the term food desert, but we also need to come to the term of complementary medicine desert or acupuncture desert or mindfulness desert. Like, are we going into the low income neighborhoods and setting up mindfulness practices and you know, different ways, and those organizations that are in those neighborhoods like the YMCA or Boys and Girls Club, how do we work with those organizations to adopt teaching mindfulness practices? So this access concern is real right now.
You also, Paula, talk about how community fellows and community scholars help increase accessibility and inclusion.
Yeah, so where I work at Cambridge Health Alliance, we have reached out into our neighborhoods and asked local businesses, local partners, somebody from a church or somebody from a yoga group that we're working with, the Mandala Yoga group. We've reached out to them and invited them to become a community scholar. And that's win-win for us, because when they're partnering with us, we learn about what are the needs of the neighborhood and what is the best way to deliver mindfulness and mindfulness training. Each culture, each group of people have their own ways of looking at the world and using words. And so only by working with the neighborhood and people in the neighborhood do we know how to adapt and like what's the right phrasing. And one of the grants we just submitted, we are asking to adapt MBS, mindfulness-based primary care or mindfulness training in primary care into Spanish. But our patient advisory group has representatives from the Dominican Republic, Puerto Rico, Latin America, Mexico, because each one of these cultures, even though everyone speaks Spanish, each one of those cultures has a unique way of looking at mindfulness and what are the words and what are the practices. So we're trying to really dig deep into listening deeply to what our patients are saying about how can we take mindfulness and bring it into their communities, but through their own lens, through a community based participatory lens.
That's wonderful. Stephanie, I was thinking about, you mentioned to me earlier that telehealth has these other ways of accommodating patients who, for instance, might find it difficult or uncomfortable to make eye contact, and that delivering telehealth to them can sort of ease some of that discomfort. Are there other examples like that that you want to offer?
I just want to mention that I think we tend to underestimate the power of having pets, and I find that people that otherwise would have difficulty addressing some past trauma, if they have their dog or cat with them, they're much more likely to start speaking about those difficult times, because pets love us unconditionally. Maybe dogs more so than cats, but that's another issue. So it's something where I think that's something that you don't really get in person. I mean, I'll have my dog be in person when I did have an in-person office, and that can be therapeutic for people, but I think having their own pet with them, and I think that there are already studies showing that lowers blood pressure and lowers overall perceived stress. But I think that not only do we have the connection of the eye contact and varying levels of eye contact based on culture, but we also have the fact that you can have your comfort items or living animals to help you through that process of uncovering some stuff that can be very difficult to talk about. And again, you're in the comfort of your own home. And there's something really to be said about that. I think when we're in stressful situations, one of the first things as humans that we want to do is go home in times of stress. And so now you're in this comfort area, and I think that you're much more likely to talk about things that otherwise would be extremely difficult.
You moved your practice online because you had to, because of the pandemic, and you've told me that you intend to continue to deliver mental health care in this way. How surprised were you by the benefits of a digital practice, the benefits to your patients?
I have been doing about 25% online up until this point. And so I guess I was surprised at how many people really liked it. I've had 98% of people prefer to be in person, even if they had or online rather than in person, if they had that option. So I find that it really works for people's lifestyles and their schedules and what they're going through. And again, you're in the comfort of your own home. And I think that the flip side to that is sometimes the in-person contact, there can be a different kind of healing process. But I think overall, the fact that people are more in a centered place when they meet with me, and they're feeling more like they can tackle their stuff instead of, okay, I need to do some deep breathings, I just went through traffic. So I think people are already in a place of getting ready to do some work when they meet with me, when they do it online rather than when they're in person.
Is that resonating for you, Paula?
It's really amazing how, for a long time, the idea, and again, I'll just speak from the medical perspective, which is that I think clinicians have been very curious about telehealth, and in a way that our behavioral health community has been more early adopting of that. And really the pandemic pushed us into really exploring telemedicine. But one thing that is interesting is that the randomized controlled trials and the research is really behind that, right? And so here we are doing this, but there are still some questions about what is better, and maybe they're both good, right? And maybe it depends on the person.
And I feel like that is true accessibility and inclusion, is to not try to fit every person into the same slot, but to have this variety of options available for delivering and receiving this care, right?
Oh, absolutely. Yeah, I think that that's important to, it's still individualized care. So we need to look at what's best for someone. If I feel like someone has an issue that probably is best handled in person, or they need to do bioenergetic work or another hands-on work, then I would refer out for that person. Because again, I don't know when I'm going back in person as of now. So I think that that's really important for us to still be open to, let's know who in the community can still serve people in person.
Stephanie, what are the limits for healthcare providers in giving access in these ways?
I think we really need to watch our hours that we're spending. So I think it's easy when you are working from home or telehealth to kind of have those work hours bleed into your personal life. And I think probably as healing people, we tend to already have some issues with that. So I think it's really important to look at, are you still working past, are you still working like at midnight answering some emails because, oh, it's so easy just for me to answer this email and then I'll go to bed. So we really need to set some limits on how much time we're going to spend at work, because consider it that you're still working even if you're at home, right? And I think we also need to look at limits on having some alone time to work with people. Luckily, during the day, it's just the dog who he's really happy I'm home all day. But I think if you have other family members, you really need to have some good boundaries about these are work hours and these are non-work hours. We need to make sure too that you're in a location where you have complete confidentiality. I think that's really important as well, but really important to have that work-life balance. It's tricky when you're at your house. But the way I view it is, this is my office. It's attached to the house, but it's my office. And I really, outside of work hours, I don't spend very much time in this room at all, because I try to keep that line. So I think that's really important for us to be aware of our boundaries, and also to do a check-in with yourself and go, how am I feeling right now? Do I feel like I need to take a break? Do I feel like I'm keeping good boundaries with myself? Am I honoring myself as a healing professional, but also as all the other hats we wear in life? So I think it's really important to establish those boundaries and stick with them, and make sure that you have time where you're not working. So even if your brain is still working, and we need to make sure that we do some practices like mindfulness practice to help ourselves detach in a loving, kind way.
This is that idea of, putting your own oxygen mask on first so that you.
Mm-hmm. Exactly. And that's the analogy I give people. Yeah.
Paula, what else needs to change at a systems level to increase access, equity, and inclusion for those who seek it? This is like this giant question, but
yeah. I mean, as we speak right now, Stephanie, in this moment, I think the thing about making sure that the clinicians that our patients are interacting with are coming from those neighborhoods. So clinicians who are people of color, or clinicians who speak the language and know the culture. That is so meaningful to our patients. And in that situation, having somebody who's from your culture can be very healing. And then also, access in terms of when are we providing care, how are we providing care, and really making people welcome. And I think one way has been the community health center. That has been a tremendous way of allowing increasing access to patients. But these socioeconomic determinants of health. So yes, there's healthcare, but also housing, safe, affordable, clean housing, food, high quality, good food, places to exercise that are safe, right? Good schools, like all of these factors bring together someone's health. So that as a movement, as a country, those are also the issues that we need to be dealing with.
why is this so important to you, Paula?
I definitely feel like I have a passion and a calling to work with patients with health disparities. And I think, when I'm activating that part of myself that values social justice and also mindfulness, I think I've always really been excited about the idea of how do you bring mindfulness and mindfulness skills to low income patients who aren't necessarily getting access. Like there's the right or the access to healthcare, but there's also the right and access to mindfulness. Mm. And we as a community of mindful clinicians and providers and practitioners and facilitators need to keep this conversation going around how can we provide mindfulness skills to everyone, regardless of whether they can pay or not pay, and how do we do that in a thoughtful, careful manner. So that's what drives me is wanting everybody to have access to mindfulness skills.
I'll add to that. I think it's important we're working with people to look at what are they already doing that's a mindful practice that they might not realize is mindfulness. Mm-hmm. I think that also makes it more accessible to people that I think that there's a chance of it seeming esoteric to people. And I think that, you're already doing a mindfulness practice probably. And that's a really good thing to key into.
I love that because, at Mindful, we talk about mindfulness as an inherent human quality. It's not mm-hmm. something you order online or buy from the store. It's within you, and you right. you can work with it and hone your ability and your skill. And I kind of love that decolonized approach, Stephanie, of you're likely already doing this. Mm-hmm. This is not something that I, like the sage on the stage, I'm going to give to you.
Right.
Oh, that is so beautifully put. In our work with these patients, it's interesting to see how there are different cultural stereotypes about what mindfulness is. And there have been times that I've had a patient who's a Jehovah's Witness, and the pastor is concerned about mindfulness skills. And I've gotten on the phone with the pastor and talked about, we're going to be breathing. We're just going to be noticing. There's nothing it's a secular practice. There's nothing religious. And then when I explain what it is, I get a thumbs up. So it's really understanding what that culture is bringing in their stereotypes, and how can we help break down the stereotypes of how mindfulness can be accessible. And I find actually that my patients who are coming from spiritual traditions or practicing prayer, when they're working with body scan or awareness of breath, it can be so second nature to them because of their prayer mm-hmm. practice. So you're totally right. Like mindfulness is everywhere. It's just part of washing dishes or brushing your teeth, right? And it's just bringing people's awareness of, oh, what is this that I'm doing? How does this help my health?
And how might I do it more intentionally, perhaps? We just have a few minutes left together, and I want to ask each of you, I'll start with you, Stephanie. What do you most want the healthcare professionals who are watching this conversation to know right now?
I think it's to become more comfortable with telehealth and different formats of providing distance care, because I think that's where things are going. And yes, the pandemic did speed that up, but I think it is here to stay. And to just explore a little bit about what's available to you in the parameters of, make sure you stay within your scope of practice, but take a look at what's available so you can reach out to more people. I think some of us maybe in behavioral health were told that we needed to kind of keep our practice kind of quiet and not speak about it, but we really need to speak for those who have been marginalized, who have had injustices done towards them. We have an obligation with our licenses to speak for those people. So I think we really need to look at other ways that we can reach out and provide advocacy.
And Paula, what about you? What do you most want the healthcare providers who are watching this to know?
That there is a toolbox for them around their self-care, and taking the time to explore what works for them, whether it's, learning self-compassion, taking a vacation, going to the gym, whatever works for them, to really keep focused on taking your passion and making it happen, and always revisiting, why did I become a clinician? Why am I interested in healing? Why am I interested in connecting with patients? You know, to always come back to what their little voice inside them says, to keep them motivated.
I'm so grateful for this conversation, for the opportunity to connect with both of you in this way and explore this vital issue in healthcare. And I thank you very much for everything that you brought to this conversation today.
Well, thank you.
Thank you. Thank you so much, Stephanie.
There's lots more to come in this healthcare summit. And if you want to continue your own journey of mindfulness, you'll find that Mindful offers dozens of digital courses, which you can do at your own pace, all led by expert mindfulness teachers and designed to be useful in your everyday life. And you can find all kinds of things at learning.mindful.org. And before you leave, if you're so moved, perhaps you would rate this session. There's a rate session button, helpfully, below the video in Whova, and it just takes a minute, and we find your input very helpful indeed. We're so glad that you were with us here today. Thank you so much for your time and your attention, and take good care.